Sierra Leone has experienced many health-related emergencies spanning human, animal, and environmental health for millennia.
The population of Sierra Leone is about 7 million people. One may consider this to be a manageable number. However, with the large number of people moving towards urban settings, environmental degradation may be a major step in diseases.
The 2014 to 2015 Ebola virus EVD outbreak that affected Sierra Leone and the West African sub-region is likely to have originated from interactions between human populations and the tropical rainforest ecosystems. In line with the recommendation by the World Health Assembly, Sierra Leone was the sixth country in Africa region to undergo the voluntary joint external evaluation in October 2016.
It is a process that brought about, can we say, the challenges of partnership. I'm of the opinion that this is the biggest block whereby partners come together for us to deliver, put our ideas together, and we were able to develop a plan and a costed plan, and we as a nation are among the first countries to have had this success.
The findings and recommendations have informed development of this National Action Plan for Health Security 2018 to 2022 through an all-inclusive multi-sectoral process.
This requires the participation of multidisciplinary specialists, multi-sectors, multilateral agencies. All of them have been on board in this work. And for instance, we now have a very good surveillance program which actually intends to detect public health events of threat to the population in the shortest possible time.
Naphs is national action plans for for health security. These are activities that are meant to strengthen the healthcare delivery system, to strengthen the Ministry of Health and Sanitation, to be able to predict, prevent, detect, and respond to diseases of public health interest. So this is very, very important to us because health is wealth. Without health, you cannot talk about education, we are talking about, you cannot talk about agriculture, you can't talk about trade. So we need to make sure this is effectively implemented and we see the impact on the ground by strengthening the healthcare system to ensure people are healthy and safe.
This plan presents costing and resource mapping by technical areas, and it is envisaged that the development partners will supplement domestic funding for the implementation to be a success.
Today being the big day for the launch, I would really like to congratulate the Minister, I would like to congratulate the Chief Medical Officer, and I would also like to congratulate all people who have been working with them in the Ministry of Health. This also, congratulation is extended to other core ministries that works very closely with the Minister of Health in ensuring this launch is made.
When a country has strong health security, it means the country can be able to prevent, can be able to timely detect and timely respond to public health threats. And once that is done, it means that the country has the ability to contain the situation before it goes out of hand. And once the situation is contained, then it means they will have less morbidity, less mortality, and we are going to protect the health system from collapsing or against shocks. And in a way also, by extension, the country will be contributing towards achievement of the global health security.
The plan will facilitate multi-sector engagement using a One Health approach, a guide implementation of activities for progress towards attainment of international health regulations, RHR 2005 core capacities required for enhancing global health security.
In Sierra Leone, Public Health England is part of the UK aid and one of the partners supporting the government of Sierra Leone to achieve the international health regulations capacities. In that role, Public Health England supported the joint external evaluation of the IHR capacities and whose findings led to the development of the National Action Plan for Health Security.
The NAPHS outlines what activities will be carried out in the medium term 2018 to 2022 in order for Sierra Leone to attain the desired capacities required for IHR and GHSA compliance.
The National Action Plan for Health Security is based on the findings from the Joint External Evaluation. This is basically the basis of development of the National Action Plan. Sierra Leone underwent this evaluation in 2016. We also conducted a scorecard review, an internal scorecard review of the Joint External Evaluation indicators in November of 2018, which also would be an annual process to ensure that the country is on track in implementing the activities that have been identified in the National Action Plan for Health Security and continues to strengthen its public health system.
Some of the key areas for improvement that were identified through the process of JEE included the need for revision of public health laws and legislation, a budget line for IHR, accelerate the implementation of the One Health approach, development of a comprehensive multi-hazard national health emergency preparedness and response plan, strengthening surveillance at points of entry, improve coordination and collaboration between human and animal health laboratory system, improve capacity, human resources, laboratory for the detection and response to chemical and radiation hazards, among several other key priorities.
Health is an end in itself. When you make health available to the people, it is their human right. And number two, it leads to healthy population. And that leads to the fact of its economic nature. When you invest in universal health coverage, the country has a productive population, and productive population gives rise to increased productivity, and increased productivity automatically will lead to increase in gross domestic product. UAC is basically about making healthcare available to everybody who needs it at any time, and that particular healthcare should be of quality one, so as the person will have a better health outcome, and nobody should suffer from inability to access healthcare because of financial problem.
The finalized Naphs will now be launched, shared internally and externally, approved by government with inclusion in the next fiscal year, and further resource mobilization carried out.
This year, 2019, government is going to embark on a major program called School Health. The school health provision will look at preventive issues, which we do now, promotive issues, and curative as well. The curative would be accessed in the community health centers in the chiefdoms, or in the secondary hospitals or tertiary hospitals in the urban settings. The initial free healthcare span covered 16 or 17% of the people. Now, on inclusion of the disadvantaged and the start of the school health, we should now be in a position to access over 50% of the people. Universal health coverage is going to be a difficult one to ascertain with the economic base of most people in the country. Government has now started, or in fact have passed through Parliament, the SLESHI, which is the Sierra Leone insurance scheme. The insurance scheme was passed through Parliament in 2018. It has not been implemented yet. The implementation would start in 2020. That implementation will start on a low scheme, a few districts, and be expanded as we go along. But we would like to make a commitment that definitely by 2030, Sierra Leone, every single Sierra Leonean will be under one insurance scheme or the other.